Welcome back to Long COVID Doctor, an educational series for all of those of you who still have long COVID. I'm Dr. Tim Robinson, formerly a family doctor, a GP for 30 years, now working in Long COVID Services for 5 years. I post on all the usual podcast channels as well as on YouTube. I hope you find them helpful. If you do, click subscribe. Let's spread the word. So, thanks again for all the feedback you send in. Apologies for the no replies. No time, sorry. I read them and I appreciate them. And please keep them coming because they help me with future postings. Another apology, my usual disclaimer. It's important though. Any advice or treatment I mention in this podcast or any other of the podcasts should only be considered after talking to your own doctor. So, this talk is all about voice problems in long COVID, and in it I will talk about the symptoms, what patients are telling us, and the causes behind those voice problems. I'll then go into what you can do, your self-help strategies to try and tackle those voice problems, and then what else we can do for those problems. So here we go, voice problems in long COVID. So, voice problems are not as common as a lot of the long COVID symptoms that our patients are experiencing, but nevertheless, they are a problem for those who have those problems. So, basically, like any new problem, we've got to take it seriously. Any new problem needs to be assessed. It deserves that attention. So, what do we always say? Any new problem, take it to your doctor. So, what are our patients actually telling us with their voice problems? What are they describing? Well, they're describing a whole range of symptoms. That could be hoarseness of their voice, or croakiness, or a raspy sort of tone to their voice. A strained voice. They feel they're straining their voice to get the noise out. Some patients describe a sort of a quiet whispering voice that they've sort of developed with this long COVID. Some people indeed actually lose their voice. They actually become aphonic, it's otherwise known as. This can happen obviously with prolonged talking. The voice actually sort of seems to give out. Patients describe their range and their pitch of their voice has gone. And they also describe that their voice feels tired and sore after speaking. They find that they need to have breaks when they're speaking. The voice problems may come with other associated symptoms, such as irritation of the throat or soreness of the throat. There may be associated excessive mucus collection at the back of the throat, and as a consequence, they find themselves needing to clear their throat repeatedly. They may also have some swallowing problems because swallowing and speech sort of occur around the same area. And so they find that they are beginning to choke on their food or liquids, or they may even find it difficulty in getting the food down the throat into the gullet. Other patients describe the feeling of a lump in the throat. Other patients feel that they are running out of air mid-sentence, and they therefore tend to gasp or pause frequently when talking. So those are the sort of main symptoms that our patients are bringing to us and the associated symptoms. So what is happening here? Why do people with long COVID have voice problems? Well, in order to understand it, we probably and most sensibly need to understand what a normal voice is before we go on into the causes for an abnormal voice. So What is a normal voice? Normal voice is, let's face it, basically the sound, the vocal sound that we make in our voice box. The voice box being the vocal cords, which is basically located, the voice box is located between the back of the throat and the top of the breathing pipe. Breathing pipe, you can feel the breathing pipe at the sort of the pit of the neck just there. And then the back of the throat is, if you look in your back of your mouth, you can see back of the throat. So basically the voice box is located midway, approximately behind the Adam's apple, the thyroid cartilage. So basically, with normal generation of the voice, of sound, okay, that happens through the pushing of air from the chest, from the lungs, from the chest, through upwards, through the vocal cords and larynx, and out through the mouth. The words are made by movement of our lips and our tongue. But those words wouldn't come about if there wasn't air being pushed through the vocal cords. The vocal cords have, and that is the open vocal cords. The vocal cords also have another function, and that is to protect the breathing pipe, the trachea, from fluids and food going down it. So the vocal cords shut when you're swallowing food and liquids. So, like I said, it has two functions. The vocal cords, the voice box has two functions. One is to generate sound, and in order to do that, they're open and air is being pushed up and out. But the other function is to close and to protect the breathing pipe from fluids going down and fluids and food going down. So that's the sort of the anatomy, if you like, of the voice box, the vocal cords, the larynx. Now we know that, we can now focus on what goes wrong to bring about those voice problems. So basically, any problem that is occurring between back of throat and top of the breathing pipe, i.e. the voice box, larynx, and vocal cords, will bring about voice problems. So here we are. We're dealing with long COVID, and long COVID has come about because of a prolonged and persisting COVID or a particularly severe COVID infection that hasn't resolved. The infection, you may well have got over the infection itself, but you're left with the persisting effects of the infection, namely sort of swelling and inflammation of that area, the larynx and the voice box area. So there's swelling and there's inflammation and hence irritation. With the swelling, there's narrowing of those tissues lining that passage between the back of the throat and top of the breathing pipe. And that is what results in the voice changes. It's not as simple as that, of course, because this is long COVID. There can be other sort of coincidental but confusing causes occurring at the same time, one of which is acid reflux. So acid reflux coming up the upper gastrointestinal tract from the esophagus, the gullet, and then spilling over into the larynx, into the voice box, and then irritating the voice box. So that acid can inflame that area also. And, so because you've had your COVID infection, it's inflamed already. If you've got acid being sort of chucked at it as well, that's further inflaming the area. Therefore, another cause for voice problems. Another contributory factor is breathing pattern disorder. And I talk about this in my recent update on breathlessness in long COVID. So this is the sort of uncoordinated breathing problem that becomes a habit where you're rapid breathing rather than shallow breathing. And so rapid breathing pattern disorder, which, like I said, is very common in long COVID, dries out those vocal cords. Yet another cause for voice problems is mast cell activation. Mast cell activation seems to creep in with so many problems with long COVID. And with mast cell activation, the tissues become more inflamed with the mast cells releasing their inflammatory components, and they bring about secretions in the upper airway. And then that can lead to postnasal drip, and that can lead to throat clearing, and then that can lead to further irritation of the voice box area. Other symptoms of mast cell activation may be a bit of a giveaway. Say if the patient is experiencing blocked nose or sinus congestion, or any of the other mast cell activation symptoms such as gut problems or skin problems. So mast cell activation, yet another cause. And I'm not finished. So fatigue of long COVID, the actual commonest symptom of long COVID, may well also contribute to the voice problems that patients are presenting to us. This, fatigue of long COVID, it will be more intermittent and not constant. So it's sort of voice problems towards the end of the day would make me suspect that long COVID fatigue may be part of the voice problems. And likewise, dysautonomia, another common underlying problem of long COVID. So muscle tone problems, vocal cord control loss, these factors associated with dysautonomia, that's dysfunction of the autonomic nervous system, also result in voice problems. And finally, again, sort of allied to the dysautonomic problems, and that is problems with the vagus nerve. So the vagus nerve, the parasympathetic nerve, again, so that's why it's sort of related to what I've just been saying about dysautonomia. Inflammation of the vagus nerve theoretically could cause impaired function of the vagus nerve, and hence voice problems also, because the vagus nerve, branch of the vagus nerve, is the recurrent laryngeal nerve, and the recurrent laryngeal nerve is the nerve that serves the vocal cords. Okay, so if that's inflamed, then that can cause voice problems. So, long and short of it is there are lots and lots of reasons why our long COVID patients are having voice problems. So, what are we going to do about it? So, well, you almost know what I'm going to say next, and that is, if you've got a new problem, you need to see a doctor. See your normal, usual doctor. We need a diagnosis, and we need guidance. Maybe treatment, maybe it's simple, maybe it's not simple, and you may need referral onto, in this case, because it's to do with voice, so obviously, logically, it's an ear, nose, and throat specialist, a surgeon, who can advise accordingly. You may need referral onto a speech and language therapist if you're having problems with your speech. It's obvious. So, in order for the doctor to decide on what course of action, the doctor will be wanting to ask you all about the problem, and that is your speech problem. So the history, the case history. So basically, exactly in your own words, what you're experiencing with your voice, and how often you're experiencing those symptoms, and when they're occurring, and how long for, and those factors that make those voice problems worse or better. There may be associated symptoms such as swallowing, like I've said, or pain. Part of a full history will be asking about the past medical history. And one factor that might be relevant would be asthma. Patients who are on asthma are usually controlled with a inhaler, a steroid inhaler. That can make your voice husky. So that's relevant. Likewise, the doctor will want to know about any other illnesses, and one that is obviously relevant is thyroid problems, because underactive thyroid can cause a sort of a gruffness, a harshness, a hoarseness of your voice. Then the doctor will probably want to know about, what do you do? What do you do? How do you use your voice? And thinking about occupation. Are you on telesales, so therefore using your voice incessantly throughout the day on the phone? Or are you a singer? Or are you on a regular basis professional singer, for example, because you may have developed singer's nodules on your vocal cords? You may be a sports coach, and so is always shouting out at your team. And so there's a lot of sort of voice abuse happening for all of those sort of occupations. The other, finally, and in a way it goes without saying, but I must say it, is that irritants will contribute to voice problems. So smoking or vaping will actually make your voice problems worse. And therefore, obviously, we're going to advise to give up the cigarettes or the vaping in order to help the voice problems, but also for your general health, much more important. Having gone through the case history, again, this is what GPs, family doctors do, the history, examination, investigation. So we've done the history, on to the examination. So be it the voice, you can't really, there's not a lot to examine with the voice problems. So you'd want to perhaps feel the lymph glands around the cervical lymph nodes, see if there's any swelling, either generally or a single enlarged, hard lymph gland would make you worry about other causes. The GP may want to look in the back of your throat to just see how inflamed it is and look for any sort of mucus, etc. GP will probably examine the Adam's apple, the thyroid cartilage, and just check that it's in the middle. But really, as I say, voice problems really all come from the vocal cords or thereabouts in the laryngeal area. And so really the only way to, when we're thinking of examination, to really examine the patient thoroughly is for someone to look down, not someone, an ears and nose and throat surgeon, to look down your throat with a flexible laryngoscope. It's not as awful as it sounds. Don't worry about that. It's a very narrow, flexible tube which is slid. Don't worry. It's slid up one of the nostrils and back down the throat. So you don't typically don't gag in the way that you can do with, say, upper gastrointestinal endoscopy. So it's very simple to do, and they're doing it all the time, so they've got the technique down to a fine art. But that's the way where the ear, nose, and throat specialist can actually directly visualize those vocal cords and the larynx. What else? Investigations, yes. Well, blood tests. You're going to be wanting the standard panel of blood tests for long COVID anyway, and that usually includes, well, not usually, it should include thyroid function test. Like I said, an underactive thyroid can present with a number of symptoms and signs, but one of them is hoarse voice. So, in this whole process of history, examination, investigations, the GP has obviously got their antennae and radar going full pelt, looking for red flags. Red flags, remember, I've explained this before, are those worrying symptoms and signs that are suggestive of more sinister underlying diagnoses. So really is that the rule of thumb and an absolute is that anyone who has a persisting hoarse voice for more than 3 weeks, that's pretty brief, isn't it? Should be referred by the general practitioner, family doctor, to an ear, nose and throat specialist to have their vocal cords and larynx examined, because basically hoarse voice can be the presenting symptom of cancer of the throat, cancer on the larynx, on the vocal cords. And so examination just to exclude that is essential. It's a mandate. And so remember, 3 weeks. But 3 weeks, as I said, is brief. 3 weeks is not long. But if it was just a viral sore throat that's causing hoarse voice because of acute laryngitis, that's viral inflammation of the larynx, then it would be highly unlikely that would be lasting 3 or more weeks. A viral or bacterial infection of the throat wouldn't last more than sort of a week to 10 days. So 3 weeks, I think, is a realistic length of time for reporting hoarse voice to your doctor, and not to be surprised if the doctor says, you've got to go and see an ear, nose and throat specialist to exclude anything nasty. I think the same goes for persisting sore throat, especially if it's one side, and especially if there's an accompanying lymph node which is enlarged on one side, and particularly if it's sort of hard and craggy. So those are symptoms, that red flag symptoms, as we call them, that need to be actioned and should result in a referral to a specialist, an ear, nose and throat specialist. Other red flags? Well, yeah, unfortunately there are other red flags, and that is swallowing problems, such as regurgitation or difficulties getting food down, especially if there's weight loss. We've got to refer someone with those red flags to a gastroenterologist to have an endoscopy to make sure there's not a cancer in the gullet, in the esophagus. Unexplained persisting dry cough. Again, that's not normal. If it was just a virus, it should calm down, settle down, certainly within 3 to 4 weeks. But if it's persisting beyond that, you really need certainly a chest x-ray, but probably almost certainly a referral to the respiratory team, a respiratory doctor in the hospital, a specialist who can exclude a lung cancer. So back to, that's red flags done. It's all really a bit sort of always a little bit alarming going through them, but I think it's important to go through them so we are aware and not COVID blind. Just putting a hoarse voice down to COVID and long COVID is not good medicine. It's not responsible. We've got to take all the symptoms and look at them individually. So what can be done about hoarse voice and voice problems in long COVID? Well, bearing in mind that majority of those voice problems in long COVID are due to those inflamed vocal cords and inflamed larynx, but also breathing pattern disorders and also poor voice, we can sort of start to think about how we're going to tackle those problems, those underlying problems. Well, first and foremost, there's always self-help. So being aware of your voice and looking after your vocal cords. So hydration. Like I said, rapid, shallow breathing of breathing pattern disorder can dry your vocal cords out. So hydration is important. So sips of water, just to keep it all moist in the throat. Some people use sort of steam inhalations to actually moisten, get warm vapor to that area, just to sort of free it all up and to keep it hydrated. So, water or non-carbonated, so non-fizzy drinks would be the best. They say you shouldn't really have caffeine or caffeine-containing drinks, such as, Coca-Cola or, Fanta or 7-Up, all those, because that can irritate the vocal cords, according to the literature out there. Sucking a boiled sweet, that's obviously going to create saliva, and then that will keep the vocal cords nice and moist. The other thing you can consciously do is try and avoid throat clearing. That, like I said, if you've got excessive secretions and causing postnasal drip and dripping down and irritating the larynx and the vocal cords, then repeated clearing the throat like that actually causes sort of trauma to the vocal cords each time you do that. So try and avoid doing that. Another one which is interesting in that is try and avoid whispering, because whispering, actually, in order to whisper, you need to tense your voice up and strain your voice, okay? So anything strained is never a good thing. So I try and tell yourself, don't whisper, then that is going to help you with your voice problems. Speaking habits, well, in a way, you've got to speak slowly and quietly, not shouting. Okay, no prolonged talking. Try and speak with shorter sentences and have sort of pauses whilst you're speaking. So breathing, breathing should be, like I was saying, that, one of the causes for voice problems is dysfunction of breathing pattern disorder, otherwise known as. So gentle diaphragmatic breathing, where your breathing is slow and deep rather than fast and shallow. All those self-help things are worth taking on board and sort of and trying to keep in the back of your mind to adopt, going forward. I think the other one is, of course, it's obvious, is that, like I said already, actually, we're trying to avoid irritants. And so smoking and vaping, obviously, it's logical. You want to avoid those. So smoking cessation would be sensible for this reason, but also all the, good health reasons as well. You need to treat reflux. This acid reflux, if that seems to be a contributory factor. So, if you've got also some heartburn as well, you think, so if you've got heartburn, you've probably got some acid coming up into the back of the throat, into the larynx, and also spilling over and scalding the vocal cords, contributing to voice problems. I talked about mast cell activation, didn't I? So in a way, if you feel that you've got that as well from the symptoms of the congestion of the upper respiratory tract and gut problems, skin problems, mast cell activation, classic, then that needs to be treated also. However, if you're not improving, and like I say, if your hoarse voice is going on for 3 weeks or more, you need to be referred to an ear, nose and throat specialist to have cancer excluded. Having had that excluded with the, like I said, flexible laryngoscopy, which, like I said before, is not scary, then the ear, nose and throat specialist will probably recommend or refer you on to a speech and language therapist. What do? So basically, they specialize in speech, language, but also swallowing. So they will teach you on gentle voice exercises. They teach something called semi-occluded voice tract exercises, where, it's really technical for me. Don't understand it, but this is what they do to try and get you to be trained into proper speech formation and delivery. They can coach you on breath and voice coordination. So sometimes the breathing and the voice can become uncoordinated. So they teach you on how to get the timing right, and when to breathe and when to speak, and when to swallow and when to breathe, and etc., etc. They'll also teach you on sort of exercise to reduce throat tension, but also sort of pacing and vocal hygiene strategies. So those are all the things that occupational, speech and language therapists can teach you to help you with relieving the inflammation and the functioning of the vocal cords and the larynx, the voice box. So that sort of brings me to the end of this talk on this update talk on voice problems in long COVID. So really just bringing it all together as a sort of a summary. Like I said at the start, voice problems are uncommon. They add to the long COVID burden nonetheless. So often they're overlooked by patients because, patients with long COVIDs, are more troubled by fatigue and brain fog and that sort of thing. The classic, the big two, those are the big two, but the other sort of the big 10 symptoms of long COVID. Speech and voice problems, are not really, in my book, part of the big 10 symptoms of long COVID. But like I say, if you've got speech, voice problems, with your long COVID, it's just another thing that you're having to contend with. And wouldn't it be nice if you didn't have it? So remember, the usual presentation is this hoarseness and this croakiness or raspiness of your voice, which may be associated with swallowing problems and acid reflux, maybe not. Maybe associated with that feeling of a lump in your throat, maybe not. Whatever the cause, you've got to see a doctor. You've got to get a diagnosis. You've got to get guidance and treatment if possible, or if not, referral on to an ear, nose and throat specialist. Especially, like I said, if that new hoarseness is 3 or more weeks standing. Like I said, we need to address the acid reflux or the dry irritating cough. They need to be looked into in their own right if they are particularly troublesome. Commonest cause of all this, like I've said all along, is this viral infection, and we know which virus it is. We know that it's SARS-CoV-2, the COVID-19 that causes the COVID-19 illness, the acute infection of COVID, and that causes the swelling and the inflammation of those vocal cords. And I've talked about, voice care, voice rests and, short sentences, and avoid whispering and diaphragmatic breathing. Having said all that, basically voice problems, and it is our experience that voice problems usually settle with time. Whilst you still have those problems, like all the problems in long COVID, in a way, it comes back to the same old thing, and that is acceptance. You've got them. It's unfortunate. You've just got to accept it for the time being. Recovery will happen. Again, this is our experience in the long COVID clinics that I work in. But it takes time. And that recovery will happen with natural healing and also using the information that say, I'm giving you now, aided by, those lifestyle measures. I talk about the 5 elements: nutrition, sleep, and, movement, de-stressing and social connection. All those 5 elements that will aid the recovery process. So there it is, my update on voice problems in long COVID, and I hope you found it helpful. As I said at the start, this is an educational series for you long COVID sufferers. But remember my usual disclaimer, of course, you know it now. Any advice or treatments I've mentioned, discuss with your doctor. Remember, safety first. So, I hope that's been helpful, and obviously, if it has, share it with anyone else that you know who has long COVID. They may not know what can be done about their long COVID problems, particularly if they've got voice problems. Spread the word, and if you're watching this on TV on YouTube, click subscribe. Want to spread the word, get it out to as many of you out there as there are, and we know there are lots, and especially at a time when resources for long COVID, a lot of the clinics, certainly here in the UK, are being withdrawn and decommissioned and shut down. So in a way, it's nice for me to know that you're not on your own, and these are resources that you can trust. So thanks again for all the feedback that you send me. Thanks for taking the time to do that. I know it takes time, and sharing your stories. I wish I could reply to all of you, but I get so many and my time is so limited that I really apologize that I can't reply to you. So there we are. In the meantime, I wish you well with your long COVID recovery. So from me, it's all the best to you, and until the next time, all the best. Bye-bye.